One of the things that most irritates me as a healthcare professional is when patients are scared into coming in for treatment. The things that you need to watch out for are what we call Nocebic language, which is language that makes you, in effect, feel worse instead of better. So if you've been to see a healthcare clinician and you have been told something like, you've got a joint that's out of alignment, or your pelvis is twisted, you've got one leg longer than the other, all of these kind of like words that imply there's something fundamentally wrong with the structure of your body, you're probably in the wrong place. We know that joints don't get out of alignment. At very best, they get a little bit restricted. They stop moving quite as well as they should, but they don't slip in and out of place. Exactly the same as the discs in our spine. Our spine is fundamentally a really strong, stable structure. And so when we look at cadaver studies, so when we look at what's happening in the body, when we can look at a human spine, we know that discs don't just slip in and out of place. That's not what's happening. So if you are hearing that kind of language in your consultations and that's being used as a way to get you to come back in for more treatment that you don't necessarily need, you're probably in the wrong place. What we want is to see our patients feel empowered. We want you to feel empowered, to know what to do, to look after your back, to keep yourself healthy, to feel strong, stable and confident to move and to build that stability within your spine. So if you do have an issue, if you're encountering pain, if you feel a little bit lopsided, it's probably not because you do have one leg longer than the other. It's probably more to do with the way that you're using your body and the adaptations that your body has made to cope with what's going on. So don't listen to fear-mongering language if that's what's being used to get you through the door of somebody's clinic. Seek out a clinician who makes you feel better, where you leave with a plan so that you know what it is that you can do at home to help with your own back pain.